So for this initial interview of the discourse community video, I chose Dr. Najih Hawadullah. He's a well-rounded coordinator for school districts as he's a psychologist and he's dealt with neuroscience and all the sorts. So he's in the healthcare field, and that's somewhere I want to be. He's also has his own practice, so that's always very nice too. That he works in the school districts and he has his own practice. So he deals with the kids and their families, like children, and then he also deals with everybody in his community in Chicago. So that's the reason why I chose him in particular is because of his motives to help. And he's always telling me ways he wants to help people. And he's also my mentor. So I really wanted to interview him. And also, something else that I found why I wanted to do this is because I might want to go into psychology as psychology. So something that really interests me, and that's part of why I wanted to go into the healthcare field is I want to follow his path. And he's also going to mention like all the different problems, the benefits, his major, college, how it's been for him as he went into this, um, different fields in healthcare and how healthcare is important and the challenges within healthcare because we want as for my interview, I want to understand a lot about healthcare rather than just like questions about just his specific career. And I think he will be able to do that since he does have experience in the healthcare field as he's been in it for nine years or 10. So that's going to be why I chose him. And the questions I'm going to be asking are going to be about the healthcare field and in a roundabout because he's had a lot of experience within it. Hello, my name is Khalil Saleh, and this is going to be our discourse community video initial interview. And we have Najih Awadullah. And can you give us a little introduction of yourself?
Hi, yes, Naj Hawallah. I work as clinical director for a school district's neuroscience clinic. We complete neuropsych assessments and do outpatient therapy for students and families of people in the district. Um, we complete outpatient behavioral health as well as substance use disorder intervention and neuropsych testing.
And so, what was your major in college?
In undergrad, my major was psychology.
So, what caused you to have like interest in psychology?
I took psychology as part of my gen ed grouping of classes for humanities, and I really liked it, and it was something that interested me. So I kept taking classes, and pretty soon I had taken enough classes that it would fulfill a minor, and then I decided I might as well major in this. I started working as a student in one of the labs for one of the professors as a work study student, and it was really interesting. He was a behaviorist, and we were studying human behavior, and it was something that just captured my interest for a career.
So, that's interesting that you actually got to work with your professors.
Mhm.
So, like, what are some of like your favorite parts of working in the healthcare field?
I really enjoy helping people and tracking their growth. So a lot of times when somebody is coming in to work on a problem, I think of behavioral therapy the same way somebody might think of physical therapy. When somebody goes into physical therapy, they come in and they have some sort of impairment, some sort of injury, some sort of recovery that needs to happen due to an incident or an event that happened in their life. behavioral health therapy is the same way. And so when I work with a patient, we talk about long-term and short-term goals and ways to benchmark progress to those goals, and being able to see growth, being able to see healing, be able to see recovery as people move towards their goals is really rewarding. And so that's something I like a lot about the work.
So has there ever been some kind of problem that you are facing, like with the healthcare field?
Um, well, I mean, problems occur sometimes where patients have difficulty being consistent with their treatment. Sometimes that relates to having funding obstacles. So patients who don't have enough coverage from their insurance, or from the carve out of their insurance company not covering the sufficient number of days of treatment that they need. So that's created obstacles at times, but throughout my career, we've been in different places where I've worked, we've been able to work through that with patients and figure out ways for them to get treatment. But that usually poses a risk because especially when it's like a young client or an adolescent or something, and you want them to be in long-term treatment, for example, because they got a lot of stuff going on. Sometimes it's difficult to get the clients to continue coming into their sessions. So when there's an excuse for them to not come in, like insurance obstacle or something like that, that can be tricky.
So it's very difficult.
Mhm.
What would you say is one of your like most recent accomplishments that you're very proud of?
Um, well, we were working during the pandemic on figuring out ways to do telehealth throughout the school district. That was something that was difficult for a lot of the clinicians, the practitioners here, because they never had to do telehealth before. So coming up with a procedure to do telehealth, we started using an assessment tool called the PHQ-9 to do suicide risk assessments for students online, which is something that's different than what they were used to doing in the past when there was risk for suicide. But it was something that we were able to launch, and it worked pretty smooth in doing remote learning and being able to have psych minutes with students. So that was something I was pretty proud of, was adapting to the changing work environment because of shelter in place, and it still being something where people were able to get their clinical minutes.
That's great that you guys were able to still do that. Lastly, what do you give advice for somebody like in going into the healthcare field in college right now?
There's a lot of opportunity in the healthcare field in lots of different facets of study. So if you're somebody who, like, I always talk to students about, like, let's say you have an interest in working in the healthcare field and you don't know what you want to do in the healthcare field. You don't know if you want to be a physician. You don't know if you want to be a nurse. You don't know if you want to do administrative work. There's lots and lots of opportunity in the healthcare field. In fact, I was talking to a student just a week ago who's like, his major interest is computer science. He said he wants to work in the healthcare field, but he also wants to do computer science. He was trying to figure out if he could handle the credit load of studying computer science and then studying something else, so he can maybe do computer science on the side. And I talked to him about how important that is to infrastructure in a hospital setting, and that he could work in healthcare with a computer science specialty. I mean, he might not be doing direct patient care, but that's something that's actually really important too, is managing servers and all of the, like, the computer components of it. And that was something that he hadn't thought of. So if you're going to try to find a way to work in the industry itself, and you don't know that you want to do direct patient contact, there's lots of different administrative and logistical opportunities for people to work in healthcare, even if they're not doing direct patient care.
That's great advice. And I think that's all we have time for our interview today. So, is there any last things that you want to say?
Uh, Great job interviewing, Khalil.